The revolutionary impact of artificial intelligence on early cancer detection and personalized treatment. Hello everyone, and welcome back to our channel. Today we're exploring an exciting and transformative topic in the medical field: how artificial intelligence, or AI, is revolutionizing cancer detection and personalized treatment. Cancer affects millions worldwide, and early detection coupled with effective treatment is crucial for improving survival rates. Let's delve into how AI is making significant strides in this fight against cancer. Section 1. The current challenges in cancer care. Before we dive into AI's role, it's essential to understand the challenges faced in traditional cancer care. Late detection. Many cancers are diagnosed at advanced stages when treatment options are limited. Generic treatments. Traditional therapies may not be effective for all patients due to genetic and molecular differences. Data overload. The vast amount of medical data available is difficult for healthcare professionals to process efficiently. Section 2. AI in early cancer detection. Advanced imaging analysis. Improved accuracy. AI algorithms can analyze imaging scans, like X-rays, MRIs, and CT scans, with remarkable precision. Real-world example. Researchers have developed AI models that detect lung nodules in CT scans earlier than radiologists, potentially catching lung cancer in its initial stages. Benefit. Early detection leads to earlier interventions, which can significantly improve patient outcomes. Predictive diagnostics. Risk assessment. AI can evaluate genetic markers and lifestyle factors to predict an individual's risk of developing certain cancers. Case study: AI models have been used to analyze patterns in mammograms and patient history to predict breast cancer risk up to 5 years in advance. High-risk individuals can be monitored more closely, enabling preventive measures or early treatment. Liquid biopsies enhanced by non-invasive testing. Liquid biopsies involve analyzing blood samples to detect cancer DNA. AI integration. AI enhances the detection and interpretation of these subtle genetic signals. Benefit. Provides a less invasive method for early cancer detection and monitoring disease progression. Section 3. AI in personalized treatment plans. Tailored therapies. Genomic analysis. AI processes genomic data to identify mutations driving cancer growth. Personalized medicine. Treatment plans are customized based on the patient's unique genetic profile. Benefit. Increases the effectiveness of treatments and reduces unnecessary side effects. Drug discovery and repurposing. Accelerated research. AI algorithms sift through vast chemical databases to identify potential drug candidates. Example: AI has identified existing drugs that could be repurposed to target specific cancer pathways. Benefit. Speeds up the availability of effective treatments and reduces research costs. Adaptive treatment strategies. Real-time data analysis. AI monitors patient responses to treatments and adjusts protocols accordingly. Benefit. Enhances the effectiveness of therapy by adapting to how the cancer evolves. Section 4. Enhanced patient monitoring and support. Wearable technology and remote monitoring. Continuous data collection. Wearables track vital signs, activity levels, and other health metrics. AI analysis. Identifies patterns and alerts healthcare providers to potential issues. Benefit. Enables proactive care and timely interventions without frequent hospital visits. Virtual assistants and chatbots. Patient engagement. AI-powered chatbots provide 24/7 support for symptom checking, appointment scheduling, and medication reminders. Emotional support. Some AI programs offer psychological support to help patients cope with their diagnosis. Benefit. Improves patient adherence to treatment plans and overall satisfaction. Section 5. AI in clinical trials and research. Efficient patient matching, eligibility screening. AI quickly matches patients to suitable clinical trials based on their medical data. Benefit: increases patient access to cutting-edge treatments and accelerates research. Data analysis and pattern recognition. Big data processing. AI analyzes large datasets from previous trials to identify trends and potential treatment outcomes. Benefit: improves the design of future studies and enhances our understanding of cancer biology. Section 6. Challenges and ethical considerations. Data privacy and security. Sensitive information. AI systems require access to personal health data. Safeguards. Implementing robust encryption and compliance with regulations like HIPAA is crucial. Responsibility. Ensuring patient consent and transparency in how data is used. Bias and fairness. Representative data. AI models trained on biased data can lead to disparities in care. Mitigation strategies. Using diverse datasets and regular auditing of AI systems. Benefit: promotes equitable healthcare outcomes across different populations. Transparency and trust. Explainable AI. Developing AI that can explain its reasoning to clinicians and patients. Collaboration. Encouraging partnerships between AI developers and medical professionals. Outcome: builds trust and facilitates the integration of AI into clinical practice. Section 7. The future of AI in cancer care. Integration with other emerging technologies. Combining AI with robotics, enhancing surgical precision and reducing recovery times. Nanotechnology and AI, targeted drug delivery systems controlled by AI algorithms. Global impact. Telemedicine. AI-powered platforms bringing expert care to remote and underserved areas. Education and training. AI tools aiding in the training of healthcare professionals worldwide. Continuous learning systems. Adaptive AI. Systems that learn from new data to improve over time. Benefit: keeps pace with the rapidly evolving field of oncology. Conclusion. In summary, artificial intelligence is playing a pivotal role in transforming cancer care, from early detection to personalized treatment and patient support. While challenges like data privacy and algorithmic bias exist, the potential benefits for patients are profound. AI doesn't replace healthcare professionals, but rather empowers them to provide more precise and effective care. Thank you for joining us on this journey into the future of cancer treatment. If you found this video informative, please like, share, and comment below with your thoughts. Don't forget to subscribe to our channel and hit the notification bell to stay updated on the latest medical innovations. Together, let's continue to explore the advancements that are shaping the future of healthcare. Your support makes a difference. Creating these in-depth videos involves extensive research, countless hours of content development, and numerous iterations to ensure we bring you the most accurate and engaging information on medical innovations. So, if you found value in this video, please give it a thumbs up and consider subscribing to our channel. Your support not only motivates us, but also helps us continue producing high-quality content that educates and inspires. Thank you for joining us on this journey toward a healthier future.